there. Each individual element discussed and explained in this workshop is supported by scientific research. Citations for that support can be found in your handouts actually on the left-hand side there. However, like all forward-thinking and cutting-edge practitioners, we have put the science together into a collective application so as to best serve these kids and get the best results in a drug-free manner. Putting the whole collective together is the theory behind this work. Proceeds from this workshop tonight, in fact, are going towards research directly related to investigating and providing this theory. So everything tonight, because who here really came to hear my opinion? It's honest, okay, I have to take that. So everything we're going to be going over is backed by research. If there is anything that is my opinion, I will say, in my opinion, I believe this. So at any time during today's workshop, if you have any questions, raise your hand. We want to make sure we're able to answer everything. We'll have an question and answer at the end too, so just let us know everything. I'll try to explain as best as I can. Again, it has to be slowed down. Sometimes I speak a little fast, or I start getting excited about certain topics, so we just want to make sure everyone's on the same page. Also, if you have a phone, I put mine on vibrate. Just put on vibrate. I know you guys have kids. Sinners might be trying to contact you or anything else. We still want to make sure it's just not ringing. Okay? All right. So this is our perfect storm, a recipe for ADHD, SPD, which is sensory processing disorder, and other health challenges in kids. So a little bit about myself. My name is Dr. Jeff Burrows. First off, I am an uncle. I have 3 nephews. My girlfriend, she has 2 nieces, and I have a step uncle, I guess he called him Coco Jeff, long story, Margarita's son, known him since, obviously, since he was born. But that's what I really take pride in, just love being around the kids. Professionally, I'm part of the ICPA, which is the International Chiropractic Pediatric Association. I go around taking courses on how we can help kids as much as we can, also train the moms. I'm part of Cedar MAC, which is a Municipal Alliance Council. We go out and we help fund different events in the schools, in the town, on anti-bullying, anti-drugs, and also anti-alcohol. Also something, especially anti-bullying, is one of the biggest things we see popping up nowadays. It's really something that we really need to help as much as we can. And also last is the NWF, which is National Wellness Foundation. Right now I'm one of, I think, around 100 doctors tonight giving this talk. So we're a group of chiropractors and other type of doctors who go out into our neighborhoods, into our communities, to try to get information out to our community the best we can. All the proceeds from tonight actually are being donated to them, which they're using to help fund different research and try to help these kids the best we can. And last but not least, pediatric and family chiropractor. We focus in on kids and our families. We love seeing our kids. And here are some of them. So this is what I get to do all day. I help the kids. Like we said, kids are meant to be healthy and ethically happy. So it doesn't matter what the kid comes in for. It doesn't matter what diagnosis they come in. My job as a chiropractor is to not add life to their years. We really want to make sure they're as healthy as possible. We want to make sure these kids are living to their fullest potential the best they can. You can see our little one, I think this is our littlest one, she's 7 months now, but this was Jillian, she was 3 days old. Mom called me up on the way home from the hospital just to get checked. We have a lot of different kids, obviously, throughout our day. So this is what we get to do all day. We get to hang out with kids, moms, and families. We really enjoy what we do, and this is why we're out here. We want to help as many kids as we can, too. And that's one thing we're going to talk about. I'm going to give you guys an opportunity to see exactly what we do in our office, because we feel every single kid deserves the opportunity to be healthy. And that's what we're really striving for. All right. So we know what happens if people stay in the middle of the road. They get run over. And I feel that's what's happening to so many parents nowadays. They're just sitting there, and the kids are under so much stress. They're being diagnosed with ADHD, sensory processing, asthma, allergy, autism, everything that's going on. The parents are so just standing there, and just getting run over. The doctors, everyone's telling them, you gotta do this, you gotta do this, you gotta do this. And they just get run over. And that's really the old way. We need to start changing it, because these numbers are really going up and up. I remember I was going through school. I'm 43 years old. I went through Cedar High School, so I've been through here, lived in town my entire life. When I was going through school, I remember maybe 1, 2 kids who had asthma. You see the little inhalers on sports. Nowadays, you go to a sports program, you see them lined up usually. ADHD is on the rise. Autism, probably just, I think last month it came out the new stat. Again, we're seeing how it's going on the rise. So right now it seems this generation of children are unhealthy, not as healthy as the generation before them, or even 2 generations before that. And we still have to start thinking of a different way. So, to begin, we're going to give you guys a test. I know teachers are probably like, come on, really? We're just doing all this all day? But it's a fun test. If anyone's ever seen this, don't blur out the answer. But all you have to do is just follow the instructions on the system.
Maybe he missed you. Me too.
Okay, so count how many passes a team in white made. Got any answers?
Yeah, so he's
14. That's 14.
All right. So pay attention.
Did you see the movie?
You're in walking bear.
Pay attention. All right. So, who didn't see the moonwalking bear? Be honest.
Not the first time, no.
Right? And it happens all the time. It's usually like 50-50 times. But this is what happens, is that we are so focused on one thing, we miss everything else going around us. And this is the biggest thing. We are so, right now, as parents, our kids are number one. We want to do the best we can for them. And we just focus, focus, focus. But sometimes we have to start looking around us, see what we can do. So, the plan for tonight is first, is gain barrier awareness. We have to know exactly what's going on with kids. Why are kids at this stage in their lives? Why are they diagnosed with different problems? Second, probably most important, we want to get some answers. And we go into that. And last, we'll give you some action steps that you're able to do, take home, and start doing those right away. So, I usually have 2 rules. I learned them probably in 2nd or 3rd grade. Don't call kids names. Don't do drugs. Really basic. Every time I think, you call a kid a name, diagnosis, we'll call it, it just, I don't know, to me, it just doesn't make sense. I understand doctors like to diagnose because then the parents want, okay, my kid has this, let's try to do something about this. A lot of times when it's diagnosed, they get pigeonholed. They get that television, that awareness goes away. So I always look at, autism, ADHD, Asperger's, asthma, allergy, anxiety. So all start with A. I always call all our kids awesome. That's how I look at it. Last one is don't do drugs. Nowadays, probably teachers could probably tell us, and parents too, how many kids are on the Prozac, Adderall, Zoloft, Keppra, phenobarbital. These kids are getting drugged up so much. And is it helping them? Are they getting better? Or are they still just dealing with what they have to? So what is the perfect storm? This is what we're going to be going in. This is the meat and potatoes of the talk. We're going to be talking about what I call the 3 T's, or 3 stresses of life. We have traumas, toxins, and loss. In the chiropractic world, this is what happens, what they cause. It's called subluxation. An easy way of thinking about subluxation is nerve disturbance. So these stresses affect our body, affect our nervous system. When they affect our nervous system, that's when we start to have problems that go wrong. So the first one, is trauma, or physical stresses. Now, a lot of times I'm going to be going back and be talking about things that I never even thought about that. Again, that's what we're here. We want to try to create some awareness. But a lot of times the physical traumas start with children is actually in the utero. Sometimes the way they're tucked into in the womb. Sometimes if they have a twin, one twin might be taking up more room than the other. Sometimes we just have big babies. And they just have so much space that they're able to do. And that leads then usually to the birth trauma. And now all births, doesn't matter if it's a C-section compared to a vaginal birth, they'll use forceps. They'll use a vacuum. They'll use a C-section to get away. Then we have childhood slips and falls as they start to get older. As they get older now, I have a nephew, he's youngest is 8 years old. If I remember 2 or 3 years old, tablet, this kid could do everything. He's like boom, boom, boom. Kids nowadays are just using tablets and smartphones all the time. The reason why that's not good at times is what probably you might even see in the paper online now, they call it text neck. The kids are constantly looking down. There's a lot of stress, physical stress on the nervous system. And then also we have car seats. Kids are just strapped in all day. Baby Bjorn is a way it helps interferes with the pelvis, bouncy seats, on and on. Now, When I was growing up, I think the age of 12, 13 years old, I remember Sunday nights, America's Funniest Home Videos came out. Every Sunday night, 7 o'clock, I think Bob Saget was hosting it then. Funniest thing I ever saw. As I got older, became a chiropractor, understood what these stresses do to our bodies, we understood what's going on. But I'm going to show you a short video. You probably recognize some of these things. I know that some of this happened to me, but just to understand how these traumas affect the kids. I've had a brother, so yes, see exactly. So I can probably go show hours and hours of that. But you can see on it what happens to our kids. We don't really think, oh, that's just kids being kids, but we start to accumulate everything together. This is where it starts to add up. So our next one is chemical stress or toxins. And you can probably go online, Dr. Google, Dr. and read books and tons on what's happening here. Actually, one of my patients she just did today, she said, telling her how her pediatrician is saying, oh yeah, the toxins that the child gets to expose to in utero could actually be affecting the child now, which I said, yeah, that makes total sense, and I'll show you a study on that. But we have, preservatives in foods, pesticides, processed foods, sugars, grains, dairy-based diets, environmental chemicals that we use, household cleaners, soaps, detergents, we have vaccinations, antibiotics, and drugs. So there's a lot of different toxicities that we get exposed to. They would show in a sample of baby cord 287 chemicals. That's a lot of chemicals that the mom is doing. It's just, we live in the Northeast. Air quality is really not the best. We're exposed to it all the time. Just talking about food, this is a movie called Food Matters, just talking about how the toxicity of what we're doing to our food line right now and how that can be affecting us.
One of the best things terrorists could do is build more fast food restaurants, maybe add another pharmaceutical company, another warrant commercials, and encourage people to eat the way they eat now. And everybody's going to be dead in 100 years. They can just walk right in, don't have to do a thing.
One quarter of what you eat keeps you alive. 3/4 of what you eat keeps your doctor alive.
One of the major problems is what we do to the soil and the air and the water, everything we take in our food.
We, for whatever reason, decided we were going to spray everything with every kind of pesticide, herbicide, larvicide, fungicide. We decided we were going to genetically modify things we don't know anything about. Can we actually improve what's already been created? The answer is maybe, but not the way we meant to.
If you want to know what's wrong, look down at the table. It's staring back.
So you can see on how
Good evening. Have a seat wherever you're comfortable.
So you can see on how the different toxins that we are doing to our food do get into our bodies. The next one is storms. Now this is probably the one that not only affects the kids, but it's also affecting everyone else around there. So the first one is the stressful fear-based pregnancies. Now, this is what usually, this is how I perceive a pregnancy, what usually happens. After 3 months or so, everyone decides, okay, we announce to the world that we're pregnant. You tell mom, they tell dad, you tell grandparents, everyone knows. It doesn't come official though until we go on Facebook and say we're pregnant. So once it's on Facebook, then everyone decides, okay, we need to start planning something. So what do? Women love to throw little parties at a little baby shower that's going on. So the baby shower comes on. Now this is what I noticed is, one of the gifts that every single mother gets is this book. I'm not sure, I think Stephen King wrote it, but it's called What to Expect When Expecting. Have you guys ever read this book and really looked at it? What it does is tell you every single thing wrong that can go with pregnancy. It's absolutely works. I've had patients come into me like, oh, I felt this could be, I'm like, first off, that's like a 0.00001 chance of happening. How did you even hear that? Oh, it's in the book here. I'm like, okay, time out. We have to take this book away from you. You can't read it anymore. And that's the best way. But this is what happens. And then we go to the doctor. The doctor says, oh, your baby's getting a little too big. We have to start doing this. You have to start doing that. And I have mothers come in who are just absolutely frantic. They're like, I'm not sure, especially the first-time mothers, it's even worse. They're just off the wall, don't know what to do. So all of a sudden now, the first thing to develop in utero, though, is the spinal cord and all the nerves. So what we always like to say is the nerves that fire together, or wire together, fire together. So if the mom's under stress the whole pregnancy, this is what the baby's going to come out of. It's going to come in a stress response right off the bat. And I'll explain that in a little more detail. So you can see this baby's just going to come out. You can see now all of a sudden this baby's already set up under stress. Now what happens once we have the baby? You know, all of a sudden 10 months, baby's ready to come out. Go to the hospital. First thing they do, they put you in a nice little wheelchair, they put a nice little gown, they lay you down on a table, they put your legs up in stirrups. And over that time, you probably have what? 5 people, 10 people coming in every 5 minutes saying, not moving too much. Okay, we'll be back. All of a sudden, the next person comes in, never met them before, look, oh, okay, that's good. Sounds good. We'll be back. That's how it goes. So mother's sitting there, first time, like, what the heck's going on? Now let's rewind this. Let's go back 10 months. Let's go back when the conception was happening. Imagine if someone came in every 10 minutes. How you guys doing? You guys almost done? Okay, we'll be back. Imagine. I mean, there's no kid to be born, but this is what's happening to the mom. The mom is all of a sudden under complete stress. She's freaking out. She's like, why is everyone coming in? What's going on? This and that. And they just keep going on and on and on. Then once the baby's due, once the baby comes out, they put him in the NICU unit. NICU unit usually sometimes 3 days, 5 days, I hear up to 6 weeks. At that time, you're not allowed to touch the child, which to me is like, that's, you know, that bond between mom and dad, or mom and baby at that time is so, so important, but yet they're not able to. Then they start to get older. They get back into school at 3 years old, 4 years old. They go into that fast-paced life. New Jersey, we're Northeast. You know, we're on the go constantly. So all of a sudden, the kid goes to school. He's in, let's say, 3rd grade. Comes home now. He's got sports. Beautiful weather out. Comes home. He's got sports. He has to go to music class. He has to go do his homework. All of a sudden, by 10 o'clock at night, oh, let's finally get him to bed. You have to be up at 6 o'clock to make sure that everything's going right. So also, we got this fast-paced life that's going. And then all of a sudden, 3rd, 4th, 5th grade, you know, little Johnny just does not want to sit in school. Oh, let's go get him sent out. Now he gets diagnosed. Now he gets diagnosed with ADHD. He might have sensory processing. He has something that's going on, and that's when usually they'll have to get medication. And then also, as they start getting older, they start getting bored. So this is probably one that, talking about the dance moonwalking there, is we don't realize what type of stress we are under. A lot of people think, oh, stress, you know, as adults, taking care of our children, taking care of families, we have our job we have to take care of. That's a stress, but we don't realize what type of stress these little kids are under. It could be from day 1 going on through here too. And again, this just keeps adding on. This is why we call it the perfect storm, because it's not just one thing. It's not just a physical trauma. It's just not a chemical trauma. It's just not emotional trauma. We have so much things that are going on with this, and this is what's happening. So this is it, the perfect storm ingredients, the new normal. Start with the fear-based pregnancy, multiple ultrasounds. I have moms coming and telling me they've had 6, 8 ultrasounds. I ask why. They're like, I don't know. Doctor said I needed ultrasounds. What does that do to us? Then we have the birth injury. Usually what happens after birth injury, sometimes we'll have colic. If anybody ever had a baby colic, if the baby's not sleeping, guess what? No one's sleeping. Well, some baby don't have colic, has children nurse because they can't really move their head around. They don't want to nurse. So they say, oh, that's fine, no problem. We got this great thing. Breast milk is good. We got something that we make just called formula. If you're looking at the first ingredient formula, it's high fructose corn syrup. It's usually in the first ingredient also in soda too. One of the worst things out there, so again, drinking soda, have your choice. For kids, really not the best thing to do. And all of a sudden they go into chronic ear infections. You have 1, excuse me, you have 1, 2. Okay, ear infection, here's an antibiotic. Doesn't work, we'll give you a strong antibiotic. Comes back, we'll give you another one. Keeps going on. I've had patients, little kids come in, around 6 rounds of antibiotics. Also at that time, wow, they have trouble breathing. Let me put on nebulizer, inhaler, singular. Then all of a sudden, wow, antibiotics not working, let's do tubes. 1 tube, 2 tubes. Well, hey, they fell out, you know, we have to put another set in. Then we have to take out the tonsils, the adenoids get infected, and then also we get a little bit older, we have video games, we have tablets, we have the iPad. We have 3 times the number of vaccines when I was younger compared to now, and then also top food environments. So we wonder, it might not have to have every single one of these, but you probably start putting things together. You're looking at your children like, wow, I've been through this, I know exactly what's going on. Unfortunately, this becomes more and more common, but I believe it should not be. So you might be thinking, why is a chiropractor talking about ADHD? Isn't it about neck pain and back pain? Actually, chiropractic deals with the nervous system, but we use the spine as a conduit. We use the spine to influence that nervous system. This is a quote from Dr. Bruce Lipton, he's a biologist out at University of California, I think Irvine, where he says the function of the nervous system is to perceive the environment and coordinate the behavior of all other cells. That first word, perceive, is probably the most important thing. Is how we perceive our environment. How is our nervous system looking around us? How is it perceiving those 3 T's? Is it perceiving where it can actually break it down and say, okay, everything's good? Or is it saying, okay, I'm having trouble, that's going on? Because now, if it's not able to perceive the environment properly, I think it's going to coordinate the behavior of the cells. You think, okay, I'm having trouble perceiving the environment, I may act a little bit not how I should. I might overreact to different environmental stimulation. That's the most important thing. What we want to make sure is that the nervous system is perceiving the environment the best it can. So, thinking about the nervous system, it is the middleman between the brain and the body. It communicates. It's one of the first things to develop. This is in utero. We have a nice brain, spinal cord. Don't even have the bone working around it. And when I talk about the spine, it's more than bones. It's more than ligaments. It's more than tendons. It's more than muscle. When I say spine, just think about the nervous system. And when we mess with the spine, we are messing with the nervous system. So each one in your folder on the right-hand side, you have this. You have both these forms. These are you guys to take home, so you can take notes, write on them. I'll need them back. The first one here is what I call the fuse box. This just goes around. We're going to use this on a little bit later too, but I just want to introduce it right now. The fuse box. This shows us where different nerves of the spine, where they go to different parts of the body, and how they cause different types of problems. So again, this is how the body is perceiving everything and how it's working. Our next one is what we call gas versus brake. This goes over, we're going to explain a little bit on how the 3 T's, traumas, toxins, and thoughts, how they can overload the system, and then they push us into what we call the gas pedal, which is the sympathetic, with fight or flight, which I'll explain to that, and then also the brake pedal, which is the parasympathetic. So this is what we're going to be working with and understanding on why the nervous system is so important. So again, subluxation, how we define that is nerve disturbance. Nice easy way of thinking about it, cause and effect. Now, I said in the beginning, this is sometimes when I start talking a little fast, when I get excited, this is nerd time. I have a degree in biology, went to chiropractic school, I love anatomy and love physiology. I can talk that all day long. But also I have to remember not everyone enjoys this much exciting. So I have to calm down a little bit, talk it out. So at any point, at any time, raise your hand, just say, back up a little bit if I need to don't need to too much. Again, the recipe are the 3 T's, traumas, toxins, and thoughts. Creating that subluxation, that nervous disturbance, and results in those 4 D's. These are our big words. You don't have to memorize them, but it's dyskinesia, disaffectation, dysautonomia, and dysplasia. Those are what we're going to deal with. And the biggest thing is our ability to adapt to the 3 T's. How is our body perceiving and adapting to that? All right. Our first one is dyskinesia. Thing about this is when the joint vertebrae gets stuck. This is like the physical aspect of subluxation. So when it's misaligned and fixed, it's not able to move around too much. And this is where we start to lose that range of motion that's going on. Now, most people will ask, when does dyskinesia start? Now, before we show this video, if anyone's, I know they won't watch it, they've seen enough, it's a C-section. If anyone's ever seen it, I want to turn away. It's a little, not gory, but it's graphic thing. Yeah. So you'll hear the music. So this if you have to turn away, but this is a typical C-section too. I've had patients who come in. The husband told me that during their birth of the C-section, that when they're getting the baby out, the mother's getting pulled down the gurney. So this one's not too bad. This is a common one. That's a C-section birth. Now, that was 90 pounds of pressure. Now, if one of you guys are holding a baby right now, 2-day-old, I came over, grabbed it by his head, what would you do? You'd probably jump on this table and start feeding it. Like, what the heck are you doing? Every single child is split out. So you can see, the WHO, World Health Organization, says there's no medical reason why C-sections should be higher than 5 to 10%. New Jersey, we're number 1. 40% of all births are C-section. This chart starts in 1999, is right here, it's a little blurry. So this is 2001. We're at 25% for so many years. Also in 1999, we went from 25% over the next 10 years up to 40%. Why? I have no idea. Can't explain it. Not sure if more moms want their baby born on a certain day. I know some moms want only a certain doctor delivering the baby. Or was it because that mom was in total stress and was not able to really push the baby out because they're in that stress response the whole time? I'm not sure. But New Jersey leads the nation in that. So this is on the left-hand side, there's a white piece of paper with all the studies. This is one study that just came out in December 2015. This talks about, it's from the Osteopathic Journal. It talks about cases of somatic dysfunction in healthy newborns. So they looked at healthy newborns, 100 of them. Looked at them, and what they found out is 99% of them, or 99 of them, 99 of 100, had some type of somatic dysfunction. Somatic dysfunction is misalignment, fixation, or dyskinesia. So 99% of our children have this. And we're wondering why kids are starting to get unhealthy. So this is what's leading up to it. Now we look at another study, birth injury, intervention, and autism, asthma, etc. What they found here is they're finally coming into the understanding it's not always our genes. It's a little bit more than that. It's how our genes are reacting to our environment. So what they found is it's not just one gene, it's multiple genes that affect on how our children are. But also potentially epistatic is the interaction between genes. It's how the genes and environment are working with each other. So that's part of the biggest thing. And so again, there's more and more studies coming out this to really say, okay, we need to start looking at not just our genes, it's not just one thing, there's multiple things that are going on. So to understand genes a little bit better, because everyone thinks, oh, I just have bad genes. You know, little Johnny was diagnosed with ADHD, they said this is genes, or autism is just genetic, it's genetic. It's not true, that's not how genes work. Just going back to Dr. Lipton again, where he puts it, probably the easiest way of thinking about it is that the genes are the car. What drives it is the epigenetics, or our reaction to the environment. So we could all have a gene right now for cancer. But that gene might not get turned on unless we get exposed to certain environmental factors that will kick that gene into action. And that's the most important thing. We want to make sure is that those genes get turned off or stay off on how we're doing. So again, our environment primary controls our genes and how that plays out are turned on and off, etc. This is especially true in life and development. So our dyskinesia now brings us into the dysapplication. Now, how many senses do we all have? 5? Actually, went up now to 7. I'll explain a little bit. So we all know, we all went to school. I know when I started learning this, I'm like, okay, makes a little bit more sense. But we do have, our sight, smell, taste, hearing, and touch. But we also have movement and also balance and coordination. So those are 2 other senses that we have that we're living through. Neurologic stimulation or movement or proprioception. Everyone familiar with these terms, proprioception at all? Okay, so I'll go into a little bit more details of it. But proprioception, or the movement of our spine, charges the brain, charges up the batteries. Now, over half the neurons that are responsible for this come from our spine. So now we're seeing on why they're important. So now when we have dyskinesia, which is what, fixation or misalignment, so those movements aren't happening the way they should. So now all of a sudden, because we're getting that stimulation to the brain, not as much as we can. So this is a great video. It's what's talking about sensory processing disorder. But it really shows on how our brain or how it works with our movements.
Some kids are really bouncy and can't sit still. Some kids aren't very coordinated. Some see food as a pile of toxic goo that hurts their mouth and jangles their taste buds. School might be a mysterious place where things don't make much sense. If this sounds like you may have sensory processing disorder, and we're going to explain it here. Your body has 7 senses: vision in your eyes, hearing in your ears, touch in your skin, taste in your mouth, and smell in your nose. And you have 2 movement senses: your muscles and your sense of boundary. In sensory processing disorder, these senses don't communicate right with your brain. Think of the nerves connecting your brain and senses as a set of roads.
Just look where they
Those
all
roads
cross.
should be smooth superhighways so that the senses and brain can communicate fast. If you have sensory processing disorder, then some of your roads are bumpy and rough. You can also think of the senses as having a...
So now where do we say we're allowed to cross? The upper cervical. What do you think? A lot of times, first thing when the doctor grabs when coming out, we're using your neck. So can we understand where this communication is happening, where it's getting jammed up? So to understand proprioception a little bit more, like you said, movement recharges our brain. 50% of it comes from the spinal cord. The spine is responsible for 60% of proprioception in the nervous system. 1/3, 33%, comes from the upper cervical. Again, where's the yellow arrow going to? Right to the upper cervical. And what do we find from the other study? 99% of kids have some type of somatic dysfunction. They have that dyskinesia because of this. So subluxation alters the input. So when we have misalignment causing the fixation, it puts the stress is stuck on. So when we look at this, we have the trauma, toxins, and thoughts. Think about this on your car, like your engine. So we start to get revved up, we have more of these adding on, until we start going here. Finally, eventually we get into what we call the red line. You know, it gets really overwhelmed, our body gets overwhelmed with the stresses, and that's when we get stuck on. Now, when it gets stuck on, it's called the gas pedal, that sympathetic system. So I'm not sure if this happened to anyone here to really experience the sympathetic system. Let's say we had a day out. Actually, probably tomorrow's going to be a little bit warmer. So let's say tomorrow, you know, you're in your car by yourself. Finally, the kids were maybe at school, or they're with grandma, everyone else, your husband's out, you know, doing everything around the yard. You're just driving around, just nice and easy. You have your favorite song on the radio, the windows are rolled down, the wind's blowing through your hair, just cruising along, singing along. All of a sudden, you look in the rearview mirror, you see 2 red lights. First thing you do is what? Look at your speedometer. You look at it 20 miles over the speed limit. What happens to you? You start to what? Sweat a little bit. Your heart's what? Coming to your chest. Your breathing's going on. What also what's happening that you don't realize is your digestive system's getting shut down. Your immune system's getting pushed down. The fats are getting released into your body. This is what we call a fight or flight or a sympathetic response. This is what happens. What happens though when we have that subluxation, when we're overwhelmed because of this dyskinesia or the disaffectation, we're stuck on. So now you can imagine what your kids will happen to your kids. You can see that they're stuck on this sympathetic overdrive all the time. Usually too, when you get into that situation, you get television. You can't really concentrate too much because you know you're just trying to see what else is going on. You can't sit still because your body wants to fight or flight. Now this system is very good. We need this system. When we were back in the day, when we were in front of down in a water hole, we came in front of a bear. We had 2 really options. And I recommend not do this with the police, please. You have 2 options: it's fight or flight. Do neither one of those. Just sit in your car and relax. But if you come across a bear, you have 2 options. You're going to turn around and try to fight it, which don't really recommend, or you can try to run away with it. So that's why your body's just going through all these actions to try to get away from this stimulus, and then we'll be able to calm down. And that's where we have the brake pedal. That's the parasympathetic. That's that calming action. But what happens is everything gets stress gets stuck on. And that's where we start seeing these start to manifest. This is where we start to see a problem coming out. So the gate theory is subluxations cause a decrease in the proprioception, which is movement, causing an increase of nociception. So proprioception and nociception are two sensations in our body. Proprioception is good, it's smooth, you feel good about it. Nociception is bad. Think of nociception right now. If I was having this conversation with you guys now and I had Metallica blasting on the radio, you guys really be paying attention to me, or you'd be like getting distracted? You might hear a word or two, but then, what's that? Okay, I'm back. Going back. That's what nociception is. And we've all experienced this. So how the gate theory works is, these two are always competing against each other. Proprioception is a little bit stronger than nociception, but once it gets up into our central nervous system, the gate theory comes down. So whoever gets there first, boom, slams the gate on the other. So if nociception is getting up into the brain, boom, it slams the gate on the proprioception. So because proprioception always has to be there to try to override the nociception. And we've all experienced this, well, I think. You know, have you ever banged your elbow or banged your toe on the corner of a dresser? Hurts like anything. But what do we all do? Oh, we start to rub it. After you start to rub it, oh, the pain goes away. Why? Because that movement. That's exactly what happens. So we're able, as we get that movement back into that body, that stimulation back up into the brain, we're able to push down that nociception. Well, when we have the dyskinesia to disaffectation, move on to our next D, which is dysautonomia. Okay. Now moves on to our fuse box. So now we get to see, depending on where those nerves are, what parts of the body they start to go to. So we have different nerves going to different parts of the body. Now, dysautonomia is a state of imbalance or dysfunction of the autonomic nervous system. So right now, we have a system in our body that's working with us even thinking. The food that you're eating right now is getting broken down by your stomach into different cells, or being broken down so our cells can use it. We're breathing in air. Our immune system right now is fighting off any bacteria or virus that we're coming into contact. Now, our autonomic nervous system controls all major systems. So our immune system is controlled by the autonomic. Our digestive system, endocrine system, and also organs, glands, and blood vessels. So you can see how important this is. So this is what happens when we're under stress though. So I'm not going to go into this. Is probably the nerdiest nerd I'm going to go into, but try to keep it as easy as I can. But we have a stimulus. Our nervous system detects it. It goes into that sympathetic overdrive we're talking about, that fight or flight, which also influences our organs, which then starts producing adrenals. So our adrenals start kicking out our hormones. Now nociception, because we're under fight or flight, starts feeding our CNS. So our amygdala, which is our stress anxiety center, our hippocampus, our learning center, and then also our frontal cortex, which takes care of behavior, personality, expression. Nociception is that more noise. So we have noise going into those centers. How do you think those centers are going to react? You think they're going to be reacting the way they should, or you think they might be overreacting to different things that are going on? And that continues on to the HPA axis, which is the hypothalamus, pituitary, and adrenals. So a lot of times, you know, you always hear with ADHD, a lot of doctors will say, wow, the kid has a chemical imbalance. And what they do, they'll give you a medication to try to balance off that chemical, which makes complete sense. But to us, to me, doesn't it make more sense to see why the chemicals imbalanced? And that's when we start going back into here. That's when we see these kids are stuck in that adrenal state, stuck in that sympathetic state, stuck in all these problems that are happening along with it. Now, what happens in vagus does not stay in vagus. Now, the vagus is one of our cranial nerves. It's one of two cranial nerves that exit the spine, comes right through the foramen magnum where the brainstem comes out, and leads right down into our spinal cord. You see it goes to all different parts of our body. It goes to our heart, lungs, liver, goes all the way down into our reproductive organs. The vagus actually means wandering. It's one of the nerves probably in the last 15 years since I graduated chiropractic school. Has been researched more and more. At first they thought it was only staying up here. They're realizing now it's going everywhere and it has such a huge, huge influence. What they're finding, this one study, the vagal intervention of the gut immune homeostasis. So what they're finding is that the vagus nerve controls on how our gut and how our immune system is working. So now when we have dyskinesia, where you say a lot of times that happens, see the upper cervical, that vagus nerve is getting pinched. Something is happening to it, it's not getting working as well as it can. So now all of a sudden, where that nerve is going to the gut immune system, is not being functioning the way it can. Because things the vagus nerve is that parasympathetic system. That is our brakeman. So when we're running around at fight or flight, all of a sudden the vagus nerve is like, okay, we're away from that, I'm going to start pumping the brake down. I'm going to start making sure, we're calming down, we're not as emotional. Speech and communication is good. Sensory regulation, we're calming, relaxing. We're slowing down our respiration, our cardiac system. Digestive motility, relaxation, and also immune boosting and anti-inflammatory. So now we can see, this is why it's important to vagus nerve. But what we've seen when we have the dyskinesia, the disaffectation is causing interference with the vagus nerve. And this is where we start to look at it. We want to see why this vagus nerve is not allowing that communication to happen, why is that brake system is not working really the best it can. So how does this deal with the children though? Dr. Lipton, again, we go back to him. He has a great book, if you ever want to read it, it's called Biology of Belief. He has also other books, but that's probably the one that's based a lot of this. But pediatric neurodevelopment. You can't be in growth and protection at the same time. So growth, look at the sheet, is usually when parasympathetic. That's when we're in a homeostasis. Everything is nice and calm. That's when we're able to hit the milestones. We're able to start to walk where we should. Everything is working the way it can. When we're in protection, that's when we're stuck. That's when we're stuck in that stress. That's when the fight or flight. So when we're in fight or flight, we're not worried about anything else except getting away from that stage as best we can. What happens when we're stuck in there? That's when we start to miss the milestones. This is where we see that lack of development with a lot of these children. So dysautonomia leads to the last theme is dysphonesis. This is a reversible physiological state consisting of unnoticed or misdirected neurophysical reactions to environmental stress, body sensations, emotions, and thoughts. Now, how many kids have you heard they can't wear their shirt because the tag bothers them? Or they just act out of nowhere. One day they're great, the next day, boom, they're off the rails. Like, what just happened? Nothing happened here. This is what happened. That's what dysphonesis is. Dysphonesis is, I know it's a little dark, errors in energy output and organization. So this is when we start to see those things. We start to see everything that's going on. So we had the dyskinesia. We had that stuff. But also now we have that disaffectation, where we're having trouble perceiving that environment, that input that's going up into our brain. This is causing a disaffectation, so our systems are not working, and now we start to see the symptoms. Now we start to see something acting out, and this is where we start to see the problems. So dysphonesia, we describe it. I know I don't like call names. This is just a way to help describe, for parents to help to understand what's going on inside the kids. I usually break it down. There's 3 of them here. The bottom one is more that autism that's really on the high end of the spectrum. We're not going to be going too deep into that. That's another 4 or 5 Ds I get into. Right now, I'm just keeping it at here. But our first one is a raging bull. This is the kid who's gas pedals on. This kid is on 24/7, 365, going. They're in that fight or flight. This is ADHD, the hyper kid, the anxiety kid. So when we do scans, nerve scans in our office, and nerve scan is, we're just checking. It's nothing that we put into the body, we take out. We're just measuring on how the body is working, how much energy is being wasted. Normally, all these numbers are based out of 100. You can see usually when we have these kids are ADHD, this one's very high, 394. We'll see the kids who are like 150, 200. They're just all wide. They're just wide up because they have so much energy that their body doesn't know where to put it out. So this scan is done. We're just sitting in a nice, relaxed, neutral position. We're not moving or anything else, but their muscles are working so much harder over this time. Our second one is what we call a drunken bull. So just imagine, a raging bull is one of those, you can see raging drunken bull. You ever see a drunk walking around? A little bit clumsy. Everything, they're not thinking clearly all the time. So this is when the brain is disorganized or disconnected. This is when sensory processing, the balance, and motor issues. So in this time, we'll look at, this is the pattern. This is the brain's ability to really understand the incoming signals. So when this number gets low, there's a lot of noise up there. The body's not really recognizing the inputs coming in, but yet it's not really hearing it the way it really should. Last one is the drunken raging bull. If anyone's ever seen a child with autism, for mom and dad, it's just crazy. They're just, kids are 24/7, but yet it's very uncoordinated. It's very, very difficult, but you see what's happening more and more, especially in New York. You see their pattern, their total energy is usually off the charts. Now, the chiropractor, I don't treat ADHD. Don't treat sensory processing disorder. Don't treat neck pain, back pain, headache, colic. I don't treat anything at all. As a chiropractor, like I said, with all our kids, what we do, and all our adults too, is we want to make sure is that their nervous system is working the best they can so they're able to perceive their environment so they can live and reach their full potential. And that's what we try to do. Because the body is made to heal itself. We just want to give it, take away the stress that's on it to allow it to do what it can do. Again, nervous system controls everything that happens in our body. Interference to the nervous system causes dysfunction, allowing sickness and disease to set in. So really tying it all together. The stress, the trauma, the toxins, and thoughts, the stress in our life, has to be processed and absorbed by the nervous system. When the nervous system is not able to do that, that's when we start to get that problem. We go from the dyskinesia, causing disaffirmation, causing dysautonomia, and dyskinesis. Too much will literally hardwire our kids for a stress response, making it virtually impossible for them to heal and be well. We must do everything we can to remove and help process the stress. Right. So this is just it's a poem. It's going to play, but just read out. I think it's just something to really understand on what I think a lot of people are doing. Oops, sorry.
I realize this may be a shock, but happiness comes from within is a lie, and money will make me happy. So in 30 years, I will tell my children they are not the most important thing in my life. My employer will know that I have my priorities straight because work is more important than family. I tell you this, once upon a time, families stayed together. But this will not be true in my era. This is a quick fix society. Experts tell me 30 years from now, I will be celebrating the 10th anniversary of my divorce. I do not concede that I will live in a country of my own making. In the future, environmental destruction will be the norm. No longer can it be said that my peers and I care about this earth. It will be evident that my generation is apathetic and lethargic. It is foolish to presume that there is hope. And all of this will come true unless we choose to reverse it. There is hope. It is foolish to presume that my generation is apathetic and lethargic. It will be evident that my peers and I care about this earth. No longer can it be said that environmental destruction will be the norm. In the future, I will live in a country of my own making. I do not concede that 30 years from now, I will be celebrating the 10th anniversary of my divorce. Experts tell me this is a quick fix society, but this will not be true in my era. Families stayed together once upon a time. I tell you this, family is more important than work. I have my priorities straight because my employer will know that they are not the most important thing in my life. So in 30 years, I will tell my children, money will make me happy is a lie, and true happiness comes from within. I realize this may be a shock, but I can change the world, and I refuse to believe that I am part of a lost generation.
All right. Excuse me. All right, so I'm going to tell you a little bit about our office. This is one of our little rock stars. She's 14 years old. Came in for a chronic ear infection. Her mom's a drug rep. So she told me, first day, I don't believe what you do. Okay? She had chronic ear infections and didn't want to do a foot surgery. She said, I just don't want to do surgery. I said, fine, I'm the last straw. She talked to doctors in different offices, said, don't go chiropractor, they don't know what they're doing, everything else. She's a complete skeptic, she told me. Found out too, she's on the low end of the spectrum. She had nervousness, anxiety. So when we look at the scans, anytime we see color, it's a warning sign to us. It's telling me, okay, there's disturbance happening in our spine somewhere. White is normal, that's what I like to see. Green is that mild, blue is moderate, red is severe. So you can look at her scan. This is back in December 2015. This is last month. You see a big change. Ear started draining after 2 months. Excuse me. Less nervousness, better attitude, and mood, and calmer. All right. So this is why I love my job.
This is very emotional.
Excuse me. So I got an email probably 2 weeks ago. Friday, was with my girlfriend, checked my phone, I saw an email from mom, like, this guy. Usually, most parents aren't emailing me on Friday or anything else. So I opened it up, and I'm like, just read it. I practice this too. Oh, sorry. All right. I'm just going to read a little bit about this. I want to write you an email, say something. Sorry, I got it. Geez, I practice everything.
We love our kids in our office. We love the adults, but our kids are our babies. They're our babies. All
right, I got this. Okay, I want to write you this email and say something good is shifting in her. Her mood is better and she seems quote unquote normal in the way. Now she's a 14-year-old girl, teenager. You know, to change her mood is pretty good. She's feeling relief in her ears, and she's definitely calmer. She seems to understand more of what is going on. I can't wait to see how far we can go. Thank you again. I truly believe in what you do. But what really got me on that, excuse me, was that a mother only said that her daughter looked normal. She was acting normal again, which I just, I don't have any kids. I have, like I said, I'm an uncle, but I just can't see a parent looking at their daughter and saying, Mom, I know there's something off. And now, excuse me. Now to finally see that light coming back on her, just, this is why we do what we do. Excuse me, peace. So again, this is why we do what we do. This is why I love what I do. This is why I've been doing it for 15 years. And this is why we come out and do talks like this. Because we want to try to help as many kids get to where they should. There's so many kids out there who are on, you know, are not healthy as they can. They're not reaching their full potential, but I feel every single children deserves. So these are action steps for you guys. There's 3 of them. The first one that you guys get to do is start decreasing the teas. Start looking at your life. Start looking at your lifestyle. You can't come home to your house 24/7, sit with you and say, you know what? I don't know, you shouldn't be eating that. Or, you know what? You shouldn't be doing that. I can't do that. This is something you have to see. You saw what the 3 T's were, the traumas, toxins, and thoughts. And just let you know, you can never eliminate all these. I do the best I can. I try to eat the best I can. I try to do everything else, positive mental attitude, everything. Stress is always going to happen. From just the air that we breathe in, everything is going to be going on with that. So we want to do the best to reduce these stresses so the nervous system is able to perceive them better. The second one is to increase the ability to adapt. And that's where I come in. That's what we do in our office. We want to make sure we're able to take the stress off that nervous system. The nervous system is able to do that. Now, number 2 doesn't happen unless number 3 happens. Now, a lot of people will say, you know, knowledge is power. I don't think that's true at all. What real power is what you do with that knowledge. You go home right now with all this knowledge, I can give you everything I know out of my brain, put it in your brain. But if you're doing any action steps for it, guess what? It's absolutely useless. So that's what you have to do. You have to take action steps in order to making sure what you can do with this. So it doesn't matter if you're a parent, if you're a teacher, you can probably look around, you can probably help these kids out as best you can. So this is an opportunity. And I want to make sure that every single kid is able to do that. We're out here tonight. We are trying to raise funds for research. We're trying to help as many kids as we can. Like I said, we're one of 100, just a little bit over 100 doctors who are doing this throughout the country. We have all the way, I think we have 2 in England, across the United States, Canada, that are going on with this. So we're trying to do the best we can. We're probably just a few of 1,000 people right now who are listening to this. I want to make sure that you guys have the opportunity to be able to see exactly what's going on. What the opportunity consists of is actually a consultation. It's where I'll sit down with you and go CSI on your children's 3 T's. We'll find out exactly what's going on with them. I want to dig in deep. You'll probably be asking me questions you've never even thought about. Even some questions you might not even remember what the answers are. You'll probably come back the next day or call me up later. Oh, well, yeah, I forgot about this. Yeah, we want to really dig in and find out exactly where these PTs are happening, how they've happened, and how they've been affecting you. We also do a computerized scan. Scan is easy. The child has to sit there 30 seconds for one scan, another scan around 3 minutes. You can make it fun and easy for them. This is where we get to see how the nervous system is working. Now we get to really pinpoint exactly. We'll do a physical examination, also see where the dyskinesia, range of motion is going on, and then also we do reported findings. Our reported findings is where I'm going to sit down with you one-on-one and show you exactly what we found on the scan and during that. I'll tell you exactly if I can help you out, how long it's going to take, and how much it's going to cost. Then it's your choice to decide what you want to do. So we want to make sure we're able to do this. Now, if someone just came off the street into our office and they wanted to get examined, that value is $295. But because we're trying to help out as many people as we can, because you guys took time to be away from your kids, away from your families tonight, we want to make sure that each one of you have the opportunity to come in. That's just worth $47 donation. That donation is not just only for your child, that's actually for your entire family. So if you have 5 kids and two parents, bring them on in. If you have 2 kids, 1 parent, bring it in. We want to make sure we're able to help as many people as we can. Now, some of you guys might be thinking, I understand my child, why we need to get them checked. What about yourselves? The reason why I talk to moms, talk to teachers about this, because if you guys are not at your top of your game, how are you going to help out your kids? And that's the biggest thing. As moms, I love them. Oh, man. But they also drive me a little bit crazy at times because they always think about everyone but them. Moms, you have to start thinking about yourself. You guys are the GM of your house at present. You guys do everything. If you guys are down, guess what? House is down. I'm sure Margarita can say, if she's not good, what happens? Boom. Her son is this, her husband's doing that. It's not how it really should be. So you guys need to take care of yourself. I know each one of you thinking right now is about your child first. I fully understand that too. But that's why we want to make sure that donation takes care of the entire family. So we want to try to make sure you guys understand what's going on. So before you go tonight, I have a blue sheet. It's a blue sheet in each one of your files, in your folders. What I'm asking you guys to do, fill out your child's name, your name, you put an email, phone number, fill out the information, what's going on with the child to let us know what we can help. Also in the bottom corner, we have some information. If you know your schedule, you can circle that and be able to take care of that tonight too. If you do know your schedule, if you'd like to schedule right now with us, talk to Margarita before you go. We'll be able to schedule that out for you, get everything with it, we'll give you the paperwork so we're able to figure out exactly when it needs to go. If you're not sure of your schedule, you need to check out, which we know as moms, dads, families, you guys have a schedule. Circle all the information, make sure one of us, Karita, Margarita, get the form so we're able to really take care of you. So we're able to help as many people as we can. I have no more information to give you, so if you guys have any questions, we're going to open up the floor so you guys can ask any